So what we often see is it's acne in 20s and 30-year-olds. It can start in adolescence and continue, or it can start in your 20s or 30s. Hormonal acne can look just the same as teenage acne. However, often people who suffer from it have drier skin, which is frustrating for them because they have dry skin and pimples. Typically they complain about spots on the jawline and chin, and that's often seen in this particular group of patients. We think that it's due to our oil glands being super sensitive to our body's natural hormones. Oftentimes there is no cause, but it can be genetic or familial, and in some cases it's linked to medical disorders such as polycystic ovary syndrome. And therefore it's really, really important that patients are assessed for these potentially other underlying conditions. To treat hormonal acne, it's really important to diagnose and assess the condition. So you may want to exclude any underlying conditions such as polycystic ovary syndrome. Good skin care is important. Topical and oral treatments, of course, are important. Topical treatments can be those that are used in conventional acne therapy, but particularly we've got to look at hormonal treatments, such as the oral contraceptive, spironolactone, or cyproterone acetate. Hormonal treatments can be the keystone of treatment for this type of acne. The oral contraceptive is used a lot. It's used not only as a contraceptive, but for active treatment, and it can help clear acne. So it's important that if your doctor recommends it, that they pick an oral contraceptive that's for you and they assess your risk factors for it. Sometimes patients may have a flare in their acne with implantable contraceptive devices. Other treatments are things such as spironolactone, which is a very safe, effective and inexpensive treatment, and it also can be used long term. Your doctor may choose to prescribe cyproterone acetate, and that's a medication that decreases the stimulation of the oil gland so you're not as greasy, and it's often used in conjunction with the oral contraceptive. Unfortunately, hormonal acne can last a long time, months, years, and that's very distressing for the patient. Unfortunately, hormonal acne is really common and there is an increasing incidence worldwide. It's really frustrating for patients, so it's important that we recognise and treat it quickly and effectively.